Dr. Zhen Chan is a pediatrician and an entrepreneur. He's dedicated to supporting physicians in their career journeys. Born in Shanghai, China, and raised in the US, Dr. Chan earned his MD MBA at the University of Miami, completed his pediatric residency at Cornell in New York City, now practicing in Washington, D.C. He's committed to scaling Grapevyne into a platform that empowers physician workforce. So he's going to be presenting Grapevyne. So welcome, Zen.
Thank you so much. Is it okay if I share my screen?
Go ahead.
All right. And thank you for that introduction.
You're welcome.
Okay. Everybody can see it okay?
Yes.
Excellent. All right. So, well, first of all, thank you to the entire InnovatorMD group and the audience for joining us today. Like Dr. Yuli mentioned, I'm Dr. Zhen Chan. I'm a pediatrician. And alongside my co-founder, Drew Mayer, we're very excited to introduce you to Grapevyne. So I'd like to set the stage with our vision first, which is to build a community that supports physicians in our everyday lives. Through personal experience and user feedback, physicians are looking for ways to fill the gaps from our training that prevent us from making truly informed decisions in our professional careers, such as where and how we want to work. A community-based approach tackles the many pain points felt by physicians and employers in recruitment and retention, which is the core problem that we're tackling. Traditional physician recruitment does not work. The process is expensive, time-consuming, and vacant roles result in tremendous opportunity costs for employers. Current methods fail to reach the right candidates because honestly, the majority of doctors are passive job seekers who are not actively browsing job boards or responding to cold calls from recruiters who, frankly, are often seen as spam and potentially scams. And finally, physicians, whether because of getting into jobs that don't fit us or other reasons, are more and more dissatisfied with our current roles, with more than half of physicians thinking about changing jobs. Physicians now know that networking is key and informed decision making comes from talking to other doctors, but we never learned how and are often too busy and honestly sometimes too scared to reach out. Poor job fit leads to worsening levels of dissatisfaction and burnout, which can lead to understaffing, which leads to heavier burdens and greater burnout on the physicians that are left behind. This vicious cycle is something that the system desperately needs a solution for, and that's where we come in by delivering knowledge and power back to physicians. Grapevyne is a peer-to-peer job marketplace within a digital community tailored for physicians to network, to see, share, and be rewarded for successful job referrals, and to access resources for our professional development. For doctors, the job posts are designed with value details and transparency in mind, and physicians trust the person who's sending them that new job because they already know them. For employers, hiring research shows referrals result in 55% faster time to hire and employees that stay 70% longer. Excuse me. Word of mouth referrals are what organizations and candidates go to first. Grapevyne is centralizing and supercharging that process. To further facilitate this, we've designed an AI-powered super connector that will auto-curate connections to jobs, other physicians for tailored networking, and resources based on user inputs using natural language. Our value prop can be divided into where we're at today and where we see ourselves moving on in the future. For our community today, we ensure job posts are detailed and worth considering, like I mentioned, then boost that visibility through physician networks rather than external intermediaries. As we grow, we'll expand opportunities for AI-powered personalized networking to jobs, people, and resources, provide deeper employer insights to help physicians choose the right job, and then offer truly valuable career tools. For employers, every vacant role costs an estimated $7,000 to $8,000 per day in lost revenue. So our solution that enhances engagement, visibility, and candidate quality delivers strong ROI. As a physician-only platform, we have direct access to private Facebook groups, conferences, academic institutions, medical societies, in plenty of ways that traditional recruiters can't. With a growing user base, we won't just improve recruitment efficiency, we'll be able to generate workforce insights to enhance working conditions, retention strategies, and physician well-being initiatives. Currently, we are operating under two extremely competitive pricing models for our customers. In our contingency-only model, we charge $25,000 per successful placement with no upfront cost. And to align with retention goals, we take 80% at the physician start date, and then we wait 6 months, make sure that the physician stays in employment for 6 months before we take the final 20%. In our subscription model, we charge a monthly listing fee starting at $250 per month per post. That's tiered and it can decrease as you post more, and a much lower 10,000 placement fee cap as an incentive for sharing that upfront risk with us. Our onboarding and job post design process is the same regardless of the pricing model that the customer chooses. Physician users then, on the other side, receive incentives at key hiring stages after making a referral. So when the candidate submits an application, completes interviews, and starts employment, Grapevyne pays the user that referred them. And of course, if you are a user, you can apply directly to the jobs you see on the platform.
So let's talk about our market opportunity. The total addressable market is $3 billion, which is the full scope of physician recruitment in the United States. Our serviceable addressable market is $2.1 billion. That is independent healthcare organizations with 5,000 employees or less, which allows us to focus on a shorter sales cycle that is often not there when looking at enterprise clients. Our serviceable addressable market is $141 million. These are independent practices in core regions with 500 or less employees. They are often working outside of major university systems and have limited recruiting capabilities. Looking ahead, we are expecting to expand into the broader staffing market of 28.1 billion, which includes APPs, nursing staff, and temporary personnel. So how does Grapevyne stack up with the existing players in the physician staffing market? They're traditional job boards, LinkedIn, Indeed, Practice Link, Healthy Careers, and medical society job boards. These all have the same basic info with low engagement. This is partially due to using common platforms such as Healthy Careers. Next, recruiting firms, Comp Health, Jackson Physician Certs, and new players like Beginly. They are still using ineffective conventional methods that don't address core inefficiencies in the recruiting process. And finally, there's locums, which, as you know, it's expensive and it's temporary. This does not address the need to fill permanent roles with physicians. So based on our go-to-market strategy, here are our financial projections. I'm just going to highlight a few separate items. So one is 30 million revenue in year 5. We have a positive EBITDA in year 3, and we break even in year 4. Now, one thing I want to highlight are some of the factors behind some of these numbers. So we have factored in below market fees for the first 3 years. That allows us to be flexible in our negotiations now as we try to build market share. Second, our subscription model. Our subscription model, the revenue is not shown in our projections until year 3. However, we already have 4 healthcare organizations that we are in contract negotiations with that would put that subscription model in place today. We also have some additional revenue streams that we are not including in this. We feel that right now we need to be very conservative in our assumptions based on the stage of our company. So we've assembled a team that we feel really can drive Grapevyne and our vision forward. We've merged, our co-founders are merging a practicing physician with strategic insights with a founder who's built multiple physician-focused ventures. We've also expanded the team to include Hannah, our VP of Growth. She was a healthcare executive that managed over 400 million in revenue and has recruited over 1,000 physicians in her career. Sean, our VP of Technology, is a former Indeed senior engineer where he worked primarily in job development and monetization. Finally, we are further strengthened by our partnership with HealthWorks Studio, which is backed by CareFirst Blue Cross, and they help us with operations and financial guidance. So the market response to our solution has been highly positive since launching in September of 2024. We've achieved several key milestones. First, we have 8 signed contracts with healthcare organizations. We are in negotiations with a total of five other healthcare organizations right now. We have listed 70 physician positions that spread across over 10 states. And then we have over 575 active physician users, which represents a 41% month-over-month growth. Right now, we are seeking $500,000 to accelerate our growth and scale operations. This funding will be used to refine product market fit, develop AI-powered automation features for workflow optimization and data analysis, expand our marketing initiatives, and grow our engineering and client success teams.
So to close, I'd just like to say that investing in Grapevyne is more than just backing a high growth opportunity. It's a commitment to strengthening the physician community that powers our healthcare system. So thank you again for your time, and we look forward to your questions.
Great. Thank you very much. All right. You can stop sharing so that I can see. All right, there you are. Yeah, if there are any questions, please raise your hand so that I can see it. In the meantime, I'll ask some questions. Now, there are plenty of physician recruiting companies out there. I know you're using technology and all of that, but what is so different about your company?
So the core of the job post and how we gain the visibility of the post is the differentiator. Both of those are the differentiators. When Healthy Careers, Practice Link, or any medical society, if you're family medicine, AAFP's job board, if you're pediatrics like me, pedsjobs.com, they all kind of cross-link the same job post all over the place. And they're very vague. Oftentimes, they don't have the right information to get the engagement and the clicks. And a lot of times what physicians are complaining about is, hey, I don't have enough information to even engage with this post. Sometimes there are even these ghost posts, which are jobs to recruit a Rolodex of names so that in the future, when there is a position, they can reach out to these people, which is very kind of predatory to the physicians because they're applying thinking there's a job there. So key piece of differentiation there is when we're creating our job, we are making sort of like the Zillow, the Redfin, the real estate website for physician jobs. Let's get you every detail you can possibly imagine. And we have the secret sauce because Hannah has hired over 1,000 physicians. I'm a practicing physician. Drew understands doctors through his previous work. Sean's from Indeed. Like, we know what is going to get user clicks. So let's make that a very engaging post. And then we are actually paying our users to refer the jobs to other people. You don't have to be a user to see the job. You just have to, like, if you see a job and you're on the recipient end, you can see the whole thing. You can either apply. And if you decide that, oh, this isn't a good fit for me, I actually know someone now that is a good fit, I can refer again. And it just creates a little chain. And we incentivize that process, keeping the money within the physician community. And then the sourcing is between people that are already established and connected.
I think one important point too is we are building from a foundation of this is a physician first service with the technology that is built for physicians. This is not built for the clients. This is built for the physicians.
Got it. Got it. So it is more like a marketplace where are you getting revenue from both sides, from the clients and the physicians, or how does the revenue work? I know that you're getting money from the clients who hire you.
Yeah. So right now our business model is consistent of the revenue from the client side, from the organizational side. And we would, as much as possible, like to be able to have that business model support physicians gaining access to this without paying a dime. However, we understand that, there are certain things that may require us to spend a lot of costs in order to build and whatnot. And if that means a subscription model from the physician side in order to access certain quote unquote freemium features, then we can monetize in that way. But that is a future roadmap item. Right now, we are only monetizing on the organization side.
Got it. Got it. I see some hands raised. Sunil, go ahead. Introduce yourself and then ask the question.
Yeah. Can you guys hear me?
Yes.
Yes.
Okay. Thank you. Again, this is Sunil Sharma, and I work for a company called Critical River. I know Naidu very well. um, I'm a CTO plus the chief product officer and strategy officer in the company. So I have three questions. My question number one is that you are primarily focusing on the US market. Are you also thinking going outside of US market? Because US market, the population is not that big. It's very small. And which I can think of your platform, the volume is going to be the key, in my opinion. That's my first question. Second question would be definitely matching the right, the demand and supply here, great, but there are a lot of other services around that. Are you guys thinking about that? Third thing is that ultimately, I think what you're going to get through the transactions through this platform is the data. Is there any strategy, thought process about monetizing and doing something about that data? So just three questions for now. I have more because I went through the similar platform, but not for physical, but I can share more details later.
Yeah. So, Sunil, thank you for those questions, and you're very spot on with all of them. They are all conversation points that we've had. To answer number one, for right now, our go-to-market strategy is to focus on US jobs. However, on the physician side, a lot of these US jobs are places that international medical graduates are eligible for and very necessary and critical for. So there is an entire strategy of trying to build resources, connections to people, as well as just recruit international medical graduates to sign up on the platform so that they can see these jobs, because oftentimes these same jobs, they are with institutions that don't have a lot of money to be spending on recruitment, and they don't have robust residency and fellowship pipelines to fill their roles. So we have currently, out of the 70 jobs, actually, we have 57 that are eligible for J1 visa waivers, H1B, and TN sponsorship. So absolutely, that is an area we would like to capture. And then the growth, right? The entire total addressable market. If we can expand Grapevyne to the global market and help people go all over, fantastic. Like, sky's the limit there. Then your second question, which was oh man, I got so excited about that first one. I forgot what the second question was. Drew, did you
Yeah, I
write that
think
There's
there
other
are
services.
there are other ancillary services which will come with that, because there are a lot of the sticky points and they generate a lot of revenue.
Yep.
So what you guys are thinking about those ancillary or additional services, it could be the background, it could be the rating, and definitely that will depend on the level of your AI footprint into the platform. So that was my second question.
Yeah, the AI connection concept is really so that we can use AI to really streamline the process of making connections, not just to each other, but to those resources and services. So our strategic partnership strategy is to go for physician coaches, non-clinical physician advisors. If you're interested in healthcare lawyers to help you go through offers, we're partnering with them. Individuals that want to learn about healthcare finance, we can connect you with them. There's a strategy there. And as we grow, we probably can provide more consulting services as we're doing more and more of our recruiting efforts and getting more user behavior on the platform, which goes into your final question, which is, I did remember, was the data play. That is absolutely one of the things that we want to do moving forward, is once we have enough user behavior to study and to analyze, and we can deliver to organizations saying, hey, this is what doctors are paying attention to. We now have all these institutions that are willing to give us their salaries. So now we're building a salary compensation database that we can provide. Physician well-being, retention strategies, all these things are programs that organizations are trying to do and build because they would rather keep a physician as opposed to hire a new one. We can probably, through user engagement and user behaviors, start delivering those insights in the future. So that is 100% on our roadmap.
And we have client demand already for data insights. We don't have the data insights yet. We're not ready to provide them yet, but we're already getting demand for that.
Yeah, I do have a few more ideas question, but I will let Margaret, go forward. But I'll be more than happy to share some ideas
Thank you.
Okay,
and
great.
some insights.
Thank
Thank
you,
you.
Zell. Appreciate. Well, I have a few questions too. Just Zen, if you can help me to understand your financial projections. The year one, is that this year, or what year are we talking about here?
Could I let me share my screen one more time, if that's okay.
That's a partial year.
2025 or
It would
2020?
it's partially in 2024 through I'm gonna get the exact month wrong now. Middle
I
of
believe
2025.
July.
Yep,
So
Mhm.
you went live last year, 2024.
we did.
Correct.
Yeah.
Correct. We went live, but at that time in July, we didn't even have any job posts yet. So this year one projection was a pro forma we created from that time. Now we do consider, and I'll kind of go to our appendix really quickly. So this is kind of the timeline that we think about, which is that our MVP truly was launched September of 2024. And the reason why we're picking that month is because our first job was posted September 26th. So if you think about just the number of people that come onto the platform, we don't really have a MVP unless we have a job. So we consider that our launch.
So the 8 signed contracts in your seeking, your ask slide, is that part of the 12 clients? Like, 8 out of 12 so far? Am I understanding this correctly?
The 12 is inclusive. I'm assuming you're including the prospects that we have. So those are not closed contract, but 8 we do have signed.
Okay.
The 12 in the financial projections, 8 of those are included here.
Right.
So we have 8 out of 12 that are in the projections.
Got it. So
And we're currently contracting with 5 others. Now they're not signed, but
we're on track.
we're on track.
Yeah, we
Mhm.
still have the year to go, right? Many months.
Mhm.
The other curiosity I have is you have Sean Berkeley for your looks like VP of technology. Who is your software team developing this? I mean, do you contract out or you do it internally?
Drew, you want to take it? I can, doesn't matter.
Sure. So Sean is our technology team right now. He's our only employee. We have a UI UX team that is a contract team that we work with. We have support from a technology team from HealthWorks Studio. But right now we have we are running very lean right now because we are able to provide the technology that we need now to service the clients and the physicians we have. However, our next step is with this next round that we're raising, is to boost our technology team significantly. We have a contract team set up and ready to go. We've done interviews and we want to do it we want to be able to flex that time with them based on the demand that we need. But we are ready to expand, but we haven't needed to yet.
Got it. Because I do see that you do need a quite a good team and a good sized team to support scale up.
Absolutely.
Yeah.
Right.
Okay.
All right. Thank you, Margaret. Great questions, guys, and great answers. Please stick around, and there may be some questions in the chat. And then also we'll get some follow-up emails for you. Thank you very much, Zen and Drew. Great presentation.